Why do you want to look into people's mouths all day? What's so interesting about teeth? In this video I'm going to be talking about why dentistry. I've just compiled a few clips of dental students, dentists explaining their thought process of when they were applying to dentistry and why they chose dentistry, and hopefully it'll help any of you who are choosing between dentistry and something else or aren't sure if you want to do dentistry, and it might just answer the question why dentistry for people who are out there wondering why anyone would want to be a dentist.
It's creative, it's artistic, it's challenging, it's rewarding, it's constantly evolving. It opens endless possibilities for your continuing professional development, community engagement, specialty training and research.
I didn't know whether to go into arts and crafty kind of career or do dentistry, and those were my two main options, and I really struggled to pick between them. Although I didn't do art and I do miss the creative side of that, dentistry is creative in its own way. You use so many different materials and you do a lot of carving and shaping, and there's so much tooth morphology that you has to be so accurate, and you do actually have a sense of creativity and art in dentistry. And probably one of the biggest reasons why I chose dentistry over art, which I actually really loved, was because with dentistry you could pick a field that would really make a difference to someone's life. For example, when I was 13, I had one of my front teeth chipped really badly. You do feel conscious of smiling, and when he fixed it and he made it like a proper tooth, I felt so much happier.
I want to help people, I want to make a difference in people's lives, and at the same time leave something behind in the hearts and minds of people, and earn a living at the same time, but making a big difference to the world. My real goal is to teach people how to take care of themselves and teach them preventive dentistry, because if you can empower people, then there'll be less need for dentists to give people fillings and extractions. And most people have an anxiety and fear about dentists, but if you can teach them how to take care of themselves, then you make a world of difference, and you'll have less people who are anxious and more people who like to go to the dentist.
I didn't always know that I wanted to do dentistry. It wasn't something that instantly came to me. Some people say they knew they wanted to do dentistry when they were 5 years old, 10 years old. No, it was a gradual decision. When I was in sixth form, I started researching what did I want to do. I found out that dentistry was available, and I knew that I wanted to do something that involved helping people in some way. As I'd done work experience, I actually really enjoyed it because I'm quite a hands-on person. I do threading, eyebrow threading, so I use my hands quite a lot anyway. So as I've done work experience, I started to love it more and more. When I went to Nigeria, which is where I come from, I realised that they didn't have much dental care available, and it just made me really want to do something about it. So that's what sort of ignited the fire in me to do dentistry.
I chose dentistry mainly because one of my family members, when she was younger, she basically had very bad teeth. She's got learning difficulties, and it made it very difficult for her to realise how to brush her teeth. I've seen how that affected her self-esteem so much. Whenever she got the right dental treatment, it really genuinely made her life so much better. She wasn't outgoing, wasn't talkative. Now afterwards, she became so much more happy, made so much more friends, just had a better life really.
I grew up through my teenage years always wanting to be a doctor, but unfortunately I didn't do very well in my A-levels. And in those days, it was a lot easier to get into dentistry than medicine. So I thought, I know, I'll be a dentist, and then when I do really well as a dentist, I'll convert and become a doctor instead. But the funny thing was, when I actually started my dental course, I really enjoyed doing it. I enjoyed the manual dexterity skills, the fine close working, be able to use your hands, but also there was a lot of things to learn as well, and I really enjoyed finding out about teeth. I know it sounds boring, but without good teeth we can't really eat and enjoy our food, so that was really important to me. Along the way I found that you could help people and get them out of trouble, out of pain.
So since I was really young, my granddad always used to smoke, and he's smoked 40 to 60 cigarettes a day. And as I've grown older with him, his progression of his teeth has become worse and worse, to the point where he's had so many teeth taken out. And for me, that's been so emotionally traumatizing. As his grandson, I don't want that to happen to him, and I don't want that to happen to anyone else's grandparents or parents either.
I chose to do dentistry because when I was in the sixth form at school, was studying physics, chemistry and biology for A-level, and I didn't quite know what to do, so I looked at pharmacy and decided not. And then it was really between medicine, dentistry and veterinary science. Well, veterinary science was out, I don't like animals very much. And so I went to Leeds Medical School and Leeds Dental School and looked round. And I have to say the medical school then, which would have been 1971-2, was just awful. And the dental school was amazing. And they were so welcoming and so friendly and so nice. Whereas sadly the medical school was a bit the opposite. I then went and spoke to my own doctor, who said, "Oh, I don't know why you want to do medicine, awful career." And the dental practice where I went, they were again very cheery, very welcoming. They said, "Right, in the summer after your A-levels, come and work for us." And I worked as a dental nurse for the summer and loved it. And it was just so obvious that that was where I was going to go.
So I knew that I wanted to do dentistry from when I was about 13 years old. I wanted to be a vet at one stage. I thought that wasn't for me. Pilot as well. But then had a bit more of a look into dentistry, did a bit more research, and then had a really, really long think about how I wanted to go in life. I think that's important for everyone to do that, especially if it's make such a big commitment, a lot of investment of your own personal time. I thought about it, I thought about what I really enjoyed doing when I was younger. I liked doing things with my hands, I liked learning a lot, reading, and I was also quite a sociable guy. And then I thought, how can I make this into a career? Because when you do a job, it's really important that you enjoy it. Dentistry also provided something that had a lot of longevity. You always have an opportunity to grow when you're doing this course, learn, meet new people, that sort of thing. I also enjoy doing a lot of sports, but a lot of sports personnel tend to peak at the end of their careers towards the age around 35 maybe. As dentistry, you can continue doing that and developing and growing throughout your life and your career. So I think that's what pushed me forward to pursue dentistry even more.
I thought dentistry was a good option. Medicine is quite similar, in fact. However, it depends which branch of medicine you go into. So if you're working as a GP, you might not be doing a lot of operative work. Whereas with dentistry, even as a general dental practitioner, you get to do a lot of operative work. And obviously, it's not dentistry alone, you're part of a wider healthcare team. And not only you're contributing to the dental health of the community, but also working as part of the team, you can identify medical problems which you can refer appropriately and contribute to the general health of the patients as well.
I studied psychology at A-level. That's where my passion for psychology really started. More than the practical aspects, I like how it can really affect someone's confidence. And I've seen like friends and family that have had braces and stuff, and the way they can do a 180 in terms of their confidence and their self-esteem. Also, the reason I chose to do dentistry over medicine is because both my parents are doctors, and I've seen like the long hours that they work. I feel like with dentistry you have more flexibility, so you have more time to see friends and family and spend time with them.
Since I was about 8 years old, I'd always wanted to do medicine. Don't know why, but I just did. And as an 8-9-year-old, I would go to what were then the equivalent of car boot sales, things like jumble sales and church bazaars and things. Any book that was to do with medicine, I would buy it and take it away and read it. As I got to about 14 years of age, I used to do high jump and long jump, and I was talking to the senior chap doing in the school doing that, and he was about to go off to university, and he was going to study dentistry. So I just had a bit of a thought about it, and I'd always made model boats, model aeroplanes, and done things with my hands. And I suddenly got to think, well, actually that's not a bad idea, because it's a bit more practical. Okay, if I was a surgeon, then I'd be operating, but in dentistry you're basically operating, albeit in a different manner, virtually every day of your working life. And that was what led me into dentistry. So I changed tack very slightly from about the age of 14. Never looked back since. It's been wonderful.
Because of the sort of personal effects it had on me, I used to have terrible teeth, I used to hate it. I used to have this one really crooked front tooth. After I had braces, and the effect that it had on me once my teeth were straight was brilliant. It was, learn to appreciate the psychological effects that dentistry can have on our patients. And that's when I really started to get into it, and also, I was quite interested and good at science subjects, and I wanted to avoid working in an office as much as possible. So to work with your hands with people day in, day out, and to really make a difference in their lives is the reason why I chose to become a dentist.
I didn't always know I wanted to be a dentist. I had loads of different things. Like, I wanted to be an actress, I wanted to be a dancer, I wanted to be a painter, I wanted to be an accountant, I wanted to marry a rich person. In the end, it was actually, between medicine and dentistry. People are always saying, did you choose dentistry because you didn't get into medicine? You need to get the same grades to do medicine and dentistry. In the UK, there are only 13 or 14 dental schools, so it's actually harder to get into dentistry than it is for medicine. So no, I didn't choose dentistry because I couldn't do medicine. Dentistry is a part of medicine, so I definitely wanted to do something where I'm helping people. I knew I didn't want to work in labs or anything like that because I am a really social person, so I definitely wanted that thing where I can interact with patients. Dentistry actually gives you the opportunity to get to see your patients very often and build a relationship. Overall, it's just so much fun. I've got a clinic where I can see patients, interact with them. I've got a stimulated learning environment where I can practice my skills and then use that on my patients. And I've got lectures and that learning sciencey part, which I really enjoy as well. So that's why I chose dentistry, and I'm really happy with my decision. I hope it answers your question.